Hi everyone, today we're going to be doing a demonstration on a procedure called microneedling. It's also known as collagen induction therapy or CIT. This is a medical cosmetic procedure where fine needles puncture the skin to various depths to cause a controlled injury, which is in turn going to induce the skin to create more collagen, resulting in a clearer complexion, as well as more tone and elasticity in the skin, scar reduction, as well as pigmentation reduction. We also do have an in-house protocol here we have developed for active and or cystic acne, which we'll be sharing as an educational video over the next month. So please stay tuned for that one. Here we use the eDermastamp by Dermaroller product. It is the fastest motor on the market and has been licensed by Health Canada. It's important to note that this is surgical grade equipment and we do use surgical grade sterilized needles. The speed of the motor is going to be very important when we are looking at doing this procedure. If the motor is not moving quickly enough, the Dermaroller does 150 strokes per second. You're going to cause scratching along the surface of the skin, which is not only going to be very uncomfortable for your client, but you may end up causing more trauma. So very important that you're using a high quality equipment. What we do when we start is we always like to freeze our clients, so we use a 3% lidocaine. It sits for about 20 to 25 minutes. Some people do react to freezing better than others, and for that reason we do like to use the more tender areas to do our treatment area first. Prior to starting the treatment, we always like to make sure we're doing a 2 times cleanse with a 70% alcohol. It's very important that we have everything removed off of the skin, just because we are going to be causing those punctures with the microneedling, and we want to make sure that we're not introducing anything to the skin that could cause any type of infection or bacteria. So how this works is the microneedles obviously penetrate the skin at different depths depending on the area we're being treated. The deepest layer of your dermis is about 1.5 millimeters. You're really not going to have to go any deeper than that. The average forehead area, depending on how bony it is 0.3 to 0.6. Very rarely are we going to be looking for more of a depth. When we are doing this, we're looking for what's called pinpoint bleeding. We do not need anybody to be completely covered in blood when they're leaving this. What we're wanting to do is cause controlled damage and micro wounds. This will create a healing slowly and correctly rather than having your body go into emergency mode. The microneedling treatment is simply described as just really pressing that reset button on your skin and getting those new collagen and elastin fibers formed. It's important to have a controlled injury rather than a traumatic injury, which is what causes scarring. So we use different procedures here, generally just to get an overall tone and a nice complexion, as well as that nice anti-aging property. We're going to do a very nice pinprick over the entire skin. As you can see in this demonstration, we're also using a system called stamping, where we take the device and we stamp it right into the dermis of the skin. This is something we're going to do in areas where there is increased scarring or pigmentation. In order to break up a scar, you really do have to get that tightly coiled collagen that's all been cross-linked very tightly together, and you need to get that broken up. So right now, when you have a scar, the tissue is very short, it's very tight, it's non-movable, and it loses its color a lot of the time, whether it goes white, brown, or red. By stamping, we're breaking those bands and coils that are holding those collagen fibers together really nice and tightly. And once we're able to break that band open, it allows the collagen over time to release, become more malleable, have more stretch to it, and separate, and the old banding will just get flushed out through your lymphatic system. Here we use a product called CIT Hyal when we're doing the microneedling. Very important to understand different types of hyaluronic acid, which is what this is. This one is actually micronized with a glycerin. That one's going to give you a really nice slip when we're doing this. Again, we don't want any of the needles to drag, but we do want to make sure that we're using micronized and concentrated, or the other one would be sonicated. Why? Hyaluronic acid has a very large molecular structure to it, so it's really not going to get into the skin, and it also does have some properties where it's going to take moisture away from where there's more water. So if you're using a pure unadulterated hyaluronic acid, the molecular weight of it's going to be quite strong. That's a lot of the time when you feel like that weird film on your skin that almost feels dry, because you have an undoctored hyaluronic acid sitting there and it doesn't actually penetrate into the skin. So make sure you are using a medical grade one, or you're using a high quality hyaluronic acid. And in order to know what you're doing, it's called sodium hyaluronate is what you're going to want to see. Micronized, or again, sonicated, but sodium hyaluronate on the ingredients is really what you're going to want to see, as opposed to a pure hyaluronic acid that is not going to get into that dermal layer. This one has been micronized, which is effectively, it's undergone a slight modification, and it's been de-weighted so that we have those really nice spherical nanoparticles. That allows this product to go really nicely deeply into the dermis, and when we're looking at those micro punctures that we've created, it's also going to allow a very equal and spherical shape to come around and surround those areas for healing, and allow for an ideal glycoprotein to come in and also help heal those areas. The entire process to do the face takes approximately 9 to 12 minutes. It is fairly quick. Results are seen with about 30 days after. We do like to see our before and after pictures generally 4 to 6 weeks apart. Depending on what you're doing, always come and have a consultation. Generally 2 to 4 treatments is required to get to where you're kind of wanting to go, but if you're dealing with more of a larger scar tissue or more of a fibrous area, deeper pocking in the skin, more and different treatments may also be required. This is a treatment we can certainly combine in with others. After we're done, we do have our clients go home again with the high quality sodium hyaluronate, as well as we send them home with a skincare kit to use for the week. We really want to make sure that skin's well taken care of while it rebuilds its hydrolipid barrier, and that we are having that really nice, beautiful healing process to reveal that newer skin. Thank you guys so much for watching. I hope you enjoyed the video. Please let us know if you have any questions.